guys, this video is about the muscle insertion on the scapula. This is the part 4. This is part 4. Muscle insertion on the scapula. Before muscle insertion, talk about one muscle which is left in my previous video. This muscle is originate from the inferior or lower lip of the spinous process of the scapula. This muscle is called deltoid. Posterior fiber of the deltoid will originate from the lower lip of the spine of scapula. This is the deltoid muscle. Deltoid origin from the lower lip of the spine of scapula. Now talk about the insertion on the scapula. Firstly I will draw from the black marker of the insertion of the muscle. First muscle will insert on the coracoid process. This muscle is called P minor. Pectoralis minor inserted on the coracoid process of the scapula. First muscle will inserted on the coracoid process of the scapula. This muscle is called pectoralis minor. Now our second muscle from the superior angle to the inferior angle. This muscle is called serratus anterior. This muscle is called serratus anterior. Serratus anterior will originate from the medial border of the costal surface of the scapula, from the superior angle to the inferior angle. This is the insertion on the anterior view. Now on the posterior view, there is one muscle will inserted on the superior angle. This muscle is called levator scapulae. This muscle is called levator scapulae. This muscle is called levator scapulae. This muscle inserted on the superior angle of the scapula, and at the level of root of the spine, this one muscle is inserted. This muscle is called rhomboideus minor. This muscle is called rhomboideus minor. This muscle inserted at the level of root of spine of scapula, and from the lower end of the root of spine of scapula to the inferior angle, this muscle is called rhomboideus major. This is rhomboid major. Rhomboid major origin from the lower end of the root of spine of scapula to the inferior angle on the dorsal surface of the scapula. This is the rhomboideus major. So this is all about the origin and insertion of the muscle. This is the part 4, and if you like my work, then please like, share and subscribe. Thank you.